Today, we're joined by Dr. Marcus A. Rothermich. Dr. Rothermich is a board-certified orthopedic surgeon with fellowship training in sports medicine. Dr. Rothermich attended college at the University of Notre Dame and was roommates with Dr. Michael K. Ryan, also an orthopedic surgeon at Andrews Sports Medicine. He earned his medical degree from the University of Virginia and served as the president of the Orthopedic Society at the medical school. He completed his residency in orthopedic surgery in St. Louis, Missouri at Barnes Jewish Hospital in affiliation with Washington University in St. Louis. He also completed fellowship training in sports medicine at the American Sports Medicine Institute and Andrews Sports Medicine. Dr. Rothermich, thank you for joining us today.
Absolutely. Thank you. Great to be here. For sure.
I'll go ahead and start off by asking you to talk a little bit about the jerseys that are behind you.
Oh, these are some favorites. I'm up in Coleman, Alabama at our satellite office, and we love having our former patients sign some memorabilia. Our patients get a kick out of this, and it's usually a conversation starter. These are some guys I treated. Justin Simmons is a safety on the Denver Broncos. Emmanuel Thompson was a wide receiver for Troy a few years back.
Nice.
And then the one on the right there is Jamian Sherwood, who now is on the New York Jets. I treated him when he was a high school player, so that's his high school jersey. And then he went and played college ball at Auburn, and now he's on the Jets. So yeah, this is the football room. Next door is the baseball room, and so we try to. My staff is really good. We try to, if we've got a baseball guy, we'll put him in the baseball room. We down at our main office in Birmingham. We've got an Alabama room, which is like a shrine to Tuscaloosa. It's just, you can see the maroon, the crimson, just like emanating down the hallway. And so our patients get a kick out of it for sure.
So my son plays junior college baseball.
Nice.
And so who's in the baseball room, if you remember?
Yeah, there's a lot of guys who I took care of the Mets for a while. And so it appears as if I'm from Queens, New York, if you walk in that room. And it's a lot of guys that came through the Mets organization a few years ago. And then a bunch of the local guys around here.
So you're from Coleman?
No, I'm from St. Louis originally.
Okay.
And so I work at a couple of our satellite offices throughout the week. I'm in Coleman on Tuesdays, Trussville on Thursdays, and then I'm downtown in Birmingham Monday, Wednesday, Friday.
Excellent.
So where are you guys at? Where is SMA located?
So we're headquartered in Birmingham.
Oh, nice. Okay.
And we've Southern Medical was founded in 1906. We publish a specialty peer-reviewed journal, Southern Medical Journal. We are mostly primary care audience, but we have a lot of specialists that do a lot of crossover. We do a lot of specialty training for primary care. So we try to stay multi-specialty, not so much primary care, but more the team-based approach to care, where specialties, including primary care, are all sort of crossing over and learning about what's happening in different specialties, which is why this was such a great topic to talk about. So
yeah, this is one that's definitely, it's new to the orthopedic world, and we'll get into it, but it's the technology's been around for a little bit, but now it's kind of creeped its way into orthopedics, and so it's been fun for us to kind of be on the front line of some of that stuff that we're doing.
So SMA is a multi-specialty association in the Southeastern United States, and I can tell you, it's always fun when we can tie specialty medical education to sports. So talk a little bit about Andrews Sports Medicine and its affiliation with the sports programs in the South.
Of course. Well, it's a long story. How long do we have for the podcast? Yeah. So Dr. Andrews founded Andrews Sports Medicine and the American Sports Medicine Institute, which is our research institution. It's kind of a sister organization linked with the private practice, which is Andrews Sports Medicine. And he started his practice in Columbus, Georgia, and then came to Birmingham in I believe it was the mid 80s. And so the practice has been around for almost 40 years now, and it has grown and changed in a lot of different ways. And now it's a multi-specialty orthopedic practice that we've got spine surgeon, hand, foot specialists. We do joints, both primary and revision total joints. And then sports medicine, obviously, is a major part of what we do. And so I was fortunate enough to do my fellowship training, kind of the end of that long educational road that you described.
Yeah.
I was one of the lucky few to get to train here and to get to finish up my training process with the guys here. So Jeff Dugas and Lyle Kane are kind of the immediate successors to Dr. Andrews, and they were my mentors in fellowship, and now grateful to be surgical partners with them. And so Andrews is it's a practice here in town that in Birmingham that really specializes in all different types of sports injuries. You know, I think a lot of people think we're baseball specialists or we're shoulder and elbow specialists, but that's a part of what we do. Most of my patients are not high school, collegiate, or professional athletes. They're people of Birmingham and the greater Birmingham area who hurt their shoulder, hurt their knee, sometimes playing sports, sometimes doing completely different things, or just working, or falling down the stairs or something crazy. So so we would do really all orthopedic surgery at Andrews. We take a lot of trauma call at the ER at St. Vincent's, and so we see fracture care. We replace joints, and then do sports injuries as well. But like you said, sports is that's the fun stuff. That's what we like to talk about, and those are the ones that we talk about most often, really.
Yeah, and I think that's really important, and thank you for that. I think that there's sort of maybe a more narrow scope of what people think about when they hear injury sports medicine, but you are caring for people much farther beyond just the sports scope. So that's good to hear.
For sure.
So I'm very interested to hear about medical technology in your field. Kind of talk a little bit about some of the technology, not so much the HoloLens stuff, but just some of the other things that are happening with regards to technology. What's sort of new in the field that people need to hear about?
Well, there's a lot changing right now. This is a time when it's hard to have the perspective to know when you're in the middle of kind of a revolution and big changes that are happening. But that certainly, I think the time period we're in right now, obviously the COVID era and the pandemic has changed a lot with the way we deliver care and the way we think about caring for patients. That was by necessity, but kind of preceding that, there were some technological changes that were in the works that have now been accelerated in the last few years. And clearly not just in orthopedics or in sports medicine or in medicine in general, but in every industry and in many different markets, the emergence of technology and the generation of data is kind of a big era that we're in right now. This is the digital age or the data age. There's a few different names for it, of things that are happening in all different industries. But specifically in orthopedics and in medicine, one thing we're seeing is a lot of information, more information. It's amazing. From the beginning of my medical school career and through my training, it's amazing how much has changed in the last 15 years. It makes me a little scared about the next 15, but we're still trying to kind of keep up with everything that's going on and all the possibilities moving forward. But it's an exciting time to be relatively early in my career now, that to be a part of this and to be able to visualize how some of these changes are going to impact my practice and my career in the care and delivery of healthcare and medicine moving forward. There's been a lot in the last specific, I'd say really the last 5 or 10 years in terms of technology that we see in orthopedics, we see in baseball, we see in all different elements of our society where we're just inundated with data.
Yeah.
And you could say this started with the internet or with smartphones, but now it's like we have access to so much data. I think the challenge in healthcare and in orthopedics is how do we use that data?
Yep.
How do we make that relevant to improve the way we deliver care, to improve surgical techniques, to improve our outcomes, which is the goal for any innovation or any technology, is just to make things better. And so I think that's the major challenge. But the way we see these improvements in technology, we'll talk about the HoloLens goggles, but there's a few different things too. And I think the overall umbrella of the landscape right now is we got a lot of information. We know a lot about range of motion, about strength, about things that that we couldn't have imagined having this much detail 10 years ago. One thing I'm working on, and if it's okay with you, I'll just kind of talk about a
Yeah,
few
absolutely.
things that we're doing. Um, at Andrews and at the American Sports Medicine Institute, we are lucky enough to have a platform to do a lot of meaningful research. And we have interns, we've got PhDs, and everything in between in terms of our staff that can look at all this data that we're generating now on our patients. There's been a big move recently in the last 5 or 10 years for what we call PROs, or patient reported outcomes. And that's taking subjective, it's a lot of surveys for patients and a lot of patients contributing to feedback. Now, this is like a more eloquent version of the "How's my driving" bumper sticker. It's on a big rig on the highway.
Yeah.
But there's a lot of that. There's a lot of patient data and patient reported outcomes. And now what we're seeing in terms of healthcare and the way politics has changed things a little bit is uh, physicians and surgeons start to get nervous because we talk about bundling reimbursement or payment with outcome-based data.
Yeah.
All of that to say, data is meaningful, data is important, and I think it's important to be able to know how to manipulate that and use it to generate value, whether that's financial value or outcome value for patients. And so there's a couple different projects that we're working on right now and that I've had an opportunity to be part of. One, just as an example, is I'm part of this med tech startup that based in Texas that is looking at a robot for shoulder rehab. And so we look at, people get nervous when you talk about robotics, and we've talked a little bit about robotic knee replacement surgery and hip replacement surgery, robotic assisted surgery.
Yeah.
We see that in different specialties as well. The Da Vinci for OBGYNs, for example, and there's similar makes and models for different specialties. But we've got robotic assisted surgery, but also in the rehab space, there's a real need for objective data. And now we live in an age when we can get that. We have tools for that. And so I came across this product and got introduced to this group that's generating what was initially robotic assisted motion for stroke patients. Not my field, not anything I have any real specialty in, but there's a group this med tech group in Texas has formed a robot for passive range of motion for stroke patients who have lost the ability for active motion. And so it's kind of retraining the brain through repetitive passive motion. And so they got me involved on the orthopedic side to see, well, how can we use this technology for orthopedics? And specifically, is it possible? I've got a buddy who's a former pro baseball player, and he came to me with this idea and he said, I think we can use this for shoulder rehab. I think we can somehow apply this robot to improve physical therapy after shoulder surgery.
Yeah.
And he's an elite baseball player, but what we really started thinking about was our rotator cuff patients. And we've got elite athletes who have labral repairs and different things, but by far the majority of my shoulder patients are farmers or workers who tear their rotator cuff. And how can you use this technology to improve their lives and their outcomes? And so what we're doing right now is we're generating an orthopedic application for this robot to where, and we've got our lead physical therapist, Kevin Wilk, who's probably the most noted and world-class physical therapist in the world, who happens to be in our backyard in Birmingham. I've got him on board with this project to develop this for shoulder rehab, where now I do basically the same technique for rotator cuff surgery, depending on what the tear pattern looks like. May have to do some different things here and there, but in general, it's the same surgery. But I've got about 50 or more different physical therapists who rehab those patients all around the state and the community. And so the physical therapy assessments that I get back are really different. They all have the same protocol, they all get the same packet, but the outcome data is subjective and it's really different. It's not bad, it's just different. And so Kevin and I started working on this project to say, how can we objectify this? How can we use the ability to generate data? And so now the hope is that this robot's cool. You put your arm in it, and we're developing it now to where a patient who is 6 weeks out from a rotator cuff repair, for example, can show us their motion to the 10th of a degree, and they can show us their force generation. And that can be in kilojoules or Newton meters of force. You can apply it in a couple different ways. But the idea there is that then when I'm going to see a patient here in the clinic at 6 weeks post-op from their surgery, I'm looking at a report that doesn't say necessarily 4 out of 5 strength, range of motion about 100 degrees of flexion. That's really subjective.
Yeah.
But this gives you the ability to say this much force, this much motion specifically and objectively. Then you can compare that to a global registry of patients who
Yeah.
are all in the same bucket to say, based on worldwide 6 week rotator cuff patients, you're in the 72nd percentile. And it can be motivating to patients. It's certainly helpful for physicians to know objectively how are my patients doing. And so that's a concrete example of how to use new medical technology to improve the way we assess our outcomes. And that can change techniques too. If I say, hey, my patients aren't doing as well as I'd like them to do, or if my patients are doing great and I can tell other people, hey, try this technique, my patients are doing great. And you've got data to back it up.
So is this an assessment tool, or does it provide for more consistent rehab procedures?
I think if applied appropriately, it could definitely be both. I mean, it's the idea behind the development initially, what got us excited about it was to say an assessment tool, to say we can assess where our patients are at, to then modify the PT protocol.
Mhm.
But it can certainly be programmed to be therapeutic in different ways as well. So there's a few different things like that, and the HoloLens goggles are part of that. Robotic surgery. Again, the idea of all of this stuff is precise, objective data that we can then apply for meaningful outcomes.
Oh, absolutely. That's the name of the game. And I think you're right. We have a lot of data as we start to make that data more useful. And you close the loop on the patient's end. Now you've got the quality improvement process and the data that you need to start really implementing change, and maybe even you know making people better, faster, more consistently. So that's really interesting. Delve into the HoloLens mixed reality goggles. That was really interesting to me. I have sort of a bearing as to what that's probably like, but dive into that a little bit and talk about some of the advantages.
It's fun for sure. It's a fun new toy that we're playing with. My staff told me when I was in the OR playing around with it, it said, you look like a kid on Christmas morning. That I just got my new toy to play with. Well, and this technology's been around for a few years. We've kind of known that it was out there. The idea is, you see the people on the commercials and the virtual reality. I had never really played with that stuff. I'm not a video game guy, so I didn't really know any of that. The metaverse, all that stuff. That really wasn't me. But I kind of knew that it was out there. But that's the idea, is that you can put on these goggles and then you can see. We call it mixed reality or augmented
Yeah.
reality, where for these goggles, I need to be able to do surgery, so I need to be able to see through these things. And so, and there's a couple different. There's a few companies that have made these kind of similar makes and models now. So there's a few different varieties out there. But I've had access to get to play around with one with a company that I work with, where it's goggles that you wear during surgery. And so we all wear protective goggles anyway, when we're doing this, when we're doing any kind of arthroscopy or arthroplasty. And so these are just goggles that you wear, and they've got built into them some pretty neat technology. So they've got a headset and cameras built into the actual lenses, and so it's kind of like wearing a GoPro
Yeah.
when you're doing surgery. And then it's also got a microphone built in right over one of the bands right by the ear. And so it's a high resolution microphone that I can speak into or I can hear from, but also importantly, it doesn't pick up any peripheral noise. So we did a test run with these goggles, and I was on with one of the consultants from the company that makes these goggles, and I quizzed them and said, all right, what classic rock band is on? What song is on right now that would definitely have been a recognizable song? They couldn't hear it. And so that's important for communication, that it's, it kind of cancels out any peripheral noise. And so the idea behind this, and so it's technology, it's a wearable technology in surgery that's got a couple different uses. And so we always wear these protective goggles anyway, so it does not impede, the surgeon's visual field. There's nothing blocking my vision. And so the first couple times I did it, I just did normal surgery. Just didn't even access, didn't turn on all the bells and whistles, and just wanted to see kind of how it felt on my face when I was wearing it.
Yeah.
Lightweight, definitely not clunky. And so really it takes a case or two to get used to what it feels like, but then it just feels like you're wearing normal goggles.
Yeah.
Good visual, fields and everything. But some of the applications are intraoperative assistance with surgery. So I can get in the periphery of these goggles. So I'm wearing the goggles, I'm looking straight through, but in the periphery, I can pull up a patient's MRI, and I can pull up imaging x-rays if I'm doing a knee replacement. You can pull up all this stuff, and then in the virtual field. So I put the goggles on, and my pointer fingers become lasers. And so then I can kind of point and move things. And so I look crazy because I'm just pointing to the air and just doing this kind of stuff. But what I'm doing is I'll pull up an MRI, kind of slide it over to this part of my field. I can pull up something over here. And so it can assist when you're in surgery. Sometimes you want to know if you're decompressing a cyst, or you're looking at a meniscus tear or a rotator cuff tear. You want to see exactly what the tear pattern looked like. There can be helpful times when you want to access the images. A lot of times when I do knee replacements, I like to measure out beforehand the angle of varus on the mechanical axis, or a couple different things. And so, occasionally during surgery, you'll kind of look back and look at the computer, or have them try to pull it up on the screen in the room. So it's nice to be able to just have it up, have it in your periphery, to be able to access and scroll through images. And that's something that in different specialties, it can be really important for neurosurgery, for example, when there's precise cuts and measurements that need to be made. It can be really helpful to have that visual and that imaging accessible in your peripheral field. And one of the applications that then we've been working on, I'm a consultant for this company, and so a lot of times if we're going to show how to do their type of knee replacement, and we use robotic assisted knee replacement, and precise measurements and different things. And there's a little bit of a learning curve to that system. And so in the old days for this company, meaning a couple years ago, they, especially pre-COVID, they would fly in people from all over the world, put them up at a hotel. They'd be in surgery with me, looking over my shoulder. And then there's always, it's a little awkward because,
Yeah.
sterility, and you don't like a lot of people in the OR. And there are some challenges with that. And so there are major advantages from a teaching perspective, to being able to use this technology. And that's in the interest of the company for sure. It saves them a lot of money, but it's also better from an education standpoint visually, that now you can see literally exactly what I see through the goggles, through the lenses, through the camera. And so in this new age, this kind of post-pandemic world, it can all be virtual. And so we've done a few tests where we call in, it's essentially a Zoom call, but it could be a surgeon in the next OR, or in Peru, or anywhere around the world, who just dials in and watches, and we can communicate. And so I can be basically teaching during live surgery, and explaining how we use the system for measurements. Can answer any questions. We've deactivated the question and answer portion during surgery, just because we don't like to necessarily have a conversation during surgery. But you can teach, and with the kind of laser technology with my fingers, I can actually look at a screen. So on the arthroscopy screen, if I'm doing an ACL, for example, I can go like this and circle and draw, and then on their iPad or device, wherever they're watching, that shows up. And might not be a good drawing, but you can see what I'm circling a structure or doing something. And so the technology is amazing now, to where somebody could literally be around the world and watch live when I'm doing a surgery, and the visual capabilities of it is just far superior than in the old days. Dr. Andrews would do these surgeries where he'd have an ESPN camera crew. He'd have some Major League Baseball guy, he's doing a Tommy John, and they would literally have the ESPN
No
camera
pressure.
in the OR. Yeah, no pressure, not super sterile, not exactly what you want. And so this is it's just significantly better in terms of sterility,
Sure.
traffic flow in the OR. And then another cool feature for us, we're a training institution. We've got 6 fellows that come through each year. I was one several years ago, and so there's 6 new fellows that come through every year for a year, and we've got an arsenal of 40 or 50 different surgical techniques that we commonly perform and that they'll learn throughout the year. But how nice would it be for them to be able to actually see what my version of an ACL looks like, or Dr. Kane or Dr. Dugas's version of a Tommy John or a UCL repair, or a knee replacement. And so now you have the capability that we can record these procedures, we can edit it, we can narrate. And so the goal now, and we're still kind of in the process of doing this because it's also new, but the idea is this is the 21st century of surgical training, where our fellows come in and on day one we can hand them a flash drive and say, here's our 50 most common surgical techniques with annotated surgery, and these are videos. And it's amazing that just a few years ago, I was a fellow 7 years ago, and we were the class that wrote out the surgical technique on Microsoft Word, and even drew in a couple rough sketches. And it's amazing in just a few years how far superior this is now, where we can just hand them a flash drive and say, here you are, here's, a terabyte of data on all of our different surgical techniques. It's hugely beneficial for medical education, both for surgeons around the world wanting to learn these techniques, for our kind of homegrown fellows that are here in Birmingham. And if I've got a difficult case and I want to call somebody in, a mentor or a partner or a friend, and show them something, we have all of our patients consent to all this beforehand, so there's no privacy concerns with that. But if we've got a difficult case, there's been times in the past where I've had people call me in the middle of surgery and describe, this is what's going on, what should we do here. It's amazing now that you can literally just push a button and see what I'm seeing. And I think everybody would agree that moving forward in the 21st century of medical care, this is pretty exciting new stuff.
Oh yeah, and I'm hearing everything I'm hearing, and my perspective is mostly from a patient's perspective,
Right.
not being a medical doctor, but I'm hearing better quality, lower costs. If you're not having to bring people in and you can just have someone dial in,
Yeah.
and that's really what, to me, 21st century healthcare is all about. All the data that we have and all of the things that we're learning and becoming better at should equate to lower costs, more availability, more time savings, all those things. And that's what I'm hearing. I was wondering if it recorded. I figured that it did. And that's something that we experienced too, doing things remotely with Zoom, lots of Zoom calls. The downside is you don't see someone face to face, and there's a difference. But there is an upside, and that is that we have things that we record and we can transcribe things automatically with recordings. And so there's so much usefulness to the technology. Although it has, what COVID did is it did sort of separate us more physically. If we can get back to more of a hybrid where you are able to see people, face to face, and you can interact with people in live settings, but then use the technology and the things that we've learned from this,
Right.
To the good. That's what I hear in all this stuff.
Well, there's no doubt that a lot of this was fueled by the pandemic, and this technology again was in development and process, and in some specialties already in use. But I think now, with what's happened in the world in the last 3 years, a lot of us have gotten more comfortable with this type of technology. I've always liked this stuff. I'm kind of a tech guy, so I always get excited about how we can use this to improve things moving forward. But this is a case where, like you said, from a patient's perspective, it should, in theory, improve outcomes, lower costs, make things safer from a infectious disease standpoint. So patients, surgeons, insurance payers. How often can you get all 3 of those groups together to agree on something? I think all 3 would agree that some of this stuff is really exciting, and that's kind of the silver bullet to say, well, how can we use this technology to improve outcomes and lower costs? for patients and for payers. And it's an exciting time for sure. A little
So,
daunting to be faced with this much technology and to say, how can we use this? None of us are necessarily comfortable changing the way we do things.
sure.
But I think that's a benefit of being relatively early and being able to be savvy with this kind of stuff as it comes online, to be able to use it and to say, well, this is certainly the way of the future. That it's amazing now that, like I said, just a few years ago, Microsoft Word, a written operative technique guide, was the best we could do, and outcomes were subjective, and now we can do better because we've got more capability.
Definitely leaps and bounds. So that's a good segue. So outside of sort of parsing where we've come in a short period of time, what do you see like out into the future even further for the HoloLens application, or maybe some other things in technology? What do you forecast out maybe the next 5 years? What do you see technology doing, or just in the sports medicine field in general? Where do you see it going in the next few years?
You can definitely see there's always new things that kind of come and go, new fads, new techniques, new ways to do things. The quad ACL was one a few years ago that people got excited about. Not We didn't get excited about that at Andrews, but there were a few different, there's different fads, different trends.
Yeah.
And there's always the saying in orthopedics and in medicine that you don't necessarily want to be first and you don't want to be last.
Yeah.
But we've kind of broken that ground a little bit in being first on some things, in terms of wanting to kind of pioneer how to use this moving forward. And I think, again, we're blessed with the research capabilities with ASMI at Birmingham to be able to really crunch a lot of data in a short amount of time, and to say, these are the changes that are positive, these are ones that don't matter, and be able to really and to publish meaningful papers and projects on helping kind of guide the future of how to apply this new technology in different ways. And so I think looking forward, that's certainly where things are headed. You can feel it. You can just see that things are continuing to change. At our practice, we just did away with our electronic medical record system that we had, I think, for decades. And now it's all iPad based. And it's amazing that 2 months ago, we were still dictating into a phone and somebody had to type it and transcribe, and all that stuff's going away. I think you can, and it's hard. And it's, for the last 2 months, we've been learning what clicks to click and how to do things differently. And that's kind of painful, but once you get it, it doesn't take long to realize, well, we were in the dinosaur ages back in January, and we're moving forward now, and this is better. And that's how I think there's going to be a lot more of those kind of epiphany moments to say, there are these opportunities out there to make improvements, and you just have to bite the bullet and learn the technology and learn how to use it. And I'm grateful, certainly, that I'm at a place that, again, kind of has a platform to say, we've got the capability, let's figure out how best to use it, and then tell other people how best, how we use it best, and move forward in that way. And so certainly a privilege to be in a leadership position, to be able to do some of that stuff, and to and try to push the ball down the field a little bit, and say, here are the things we find that are valuable, that can improve outcomes. And whether it's a new electronic medical record system, and we're all figuring out how to use the iPads, or if it's really slick, cutting edge technology, like these hologram goggles. It's exciting from top to bottom, I think, to be part of it, when you say you just have to get used to the fact that the way we've done things isn't the way we're going to do things. That moving forward, we just have to change the way we do things to keep up with the technology.
Oh, absolutely. And sometimes when you go through difficult times, like with COVID, there's a lot of good things that could come out of these things. So very interesting. Lot to think about. And I really appreciate you taking the time to speak with us today, and to share some of these things. And I hope you'll come back and do that again soon.
Absolutely, Randy. Thanks for having me on.
Yes, sir.